Welcome back. You're watching a special programme on the coronavirus outbreak. Time now for us to try to answer your questions on COVID-19. Joining me are the urgent care Dr Kishan Rees and Simon French, who is Chief Economist at Panmure Gordon. Right, now, questions from viewers. Kishan, this one's for you. Mark from Wiltshire. Does COVID-19 actually cause permanent damage to the lungs, or will an infected person completely recover from the damage caused? Quite a good question.
Sure, no, it's a great question. And I think with the wall-to-wall media coverage, it's very easy for this to potentially be blown out of proportion. So it is, of course, serious in terms of as a disease and the way that it's spreading around the world. But I would like to reassure patients as much as possible that for the vast majority of people, it will be a mild, minor illness and they will recover and that will be fine. Obviously, for the more at-risk groups and the people with pre-existing respiratory diseases or chronic diseases, if they ended up on ITU and ventilated, then the chances of that recovering back to normal is obviously less. But it's really worth emphasising that it's a very small proportion of people, and the most important things people can do is take steps to protect themselves and others. So that is wash hands, that is good hygiene. As we're seeing on London Underground at the moment, behaviour is impeccable. There's less people, and people are actually washing their hands, not sneezing all over people. So I think that's really important as well.
Yeah. OK. Kishan, back to the medical side of all this. Please explain the risks for pregnant women. That's Hannah on Twitter.
Sure. So I can completely understand how Hannah, as well as many other pregnant women across the UK, are potentially concerned. What I would suggest is that they should follow the advice of the Chief Medical Officer, Professor Chris Whitty, who you'll have seen on the news conference that's just been happened, that is saying that there is a slightly increased risk for pregnant women and more personalised health advice will be coming out over the next 7 to 14 days. So I've seen some criticism of the media in terms of hyping this up and trying to panic people. However, I think that's very unjust and unfair, because if you give no information to people in the social media environment that we live in now, people will just make rubbish up and rumours up, and that is actually more harmful. So my advice to Hannah would be there's a slightly increased risk as per what the Chief Medical Officer has come out with today, and everybody should be following him on Twitter and the advice that he issues. But they will be getting personalised advice over the next 7 to 14 days and should look out on NHS, the website for nhs.uk, as well as the World Health Organization website, who.int, which is absolutely vital resources that I'd encourage people to go to. And the one positive thing I think social media companies have done is when you search coronavirus, before you get met with the rubbish in the comment section, you get directed, or the opportunity to be directed to the NHS website, which I think is great and a positive step. What I would like to see on NHS websites is video clips from the news, short sound bites that are easy for people to digest and will put them at ease.
But the broad advice that this is a virus that affects disproportionately elder people, that hasn't changed.
No.
That's still the case.
No, that is still the case, very much so. And elderly people with pre-existing complex diseases do have the potential to get more sick. That's why we must take it upon all of ourselves to take the steps necessary to prevent the spread as far as possible.
Yeah, OK. It's a very difficult time for the elderly because of the health side of this, and then they see the value of their pensions falling like this. So, Kishan, another question from Twitter. How unwell are confirmed case people? For example, is it standard flu or are the symptoms similar, or are all requiring significant hospital treatment? I guess it just depends from case to case.
Sure. So, I mean, it's quite a complex question. There's lots of little bits in that, so we'll try and unpack it. In terms of how unwell are the confirmed case people, if they're talking about the people that have sadly died, then they're people that have had pre-existing medical conditions. In terms of the other confirmed cases, it could be a case of it could affect you or I, and it would affect people across the population in very different ways. I think in terms of is it standard flu, no. This is a new virus that has come into the world, and it is not the same as pre-existing flu. So things like flu vaccines will not be effective in this particular strain yet. Whilst it's not going to help yet because we need time to work on the vaccine, The importance of vaccines cannot be underestimated. Vaccines save lives. So the anti-vaxxers on Twitter, and I'm sure I'm going to get a lot of them now, but I think we need to use the media to educate people about public health and risk. And they don't all require significant hospital treatment. And the really important thing for this question is the vast majority of people with minor cases of flu-like symptoms should not go to hospital. And that sounds harsh, but the reason is that what we don't want to do is put undue stress on the health system, because if there is a confirmed case, then that healthcare system will be shut down, deep cleaned, people and staff have to go into isolation. So it's really important for your viewers, if you have minor symptoms, you stay at home, you dial 111 and you follow their advice.
Yeah. But the government's saying today they do want to test
potentially
those with some sort of pulmonary
and the respiratory type symptoms. They're talking about extending the testing.
Yeah, that's to find out, try and find out a bit more about how many people have actually got this.
Yes.
OK, we're riding two horses here, economy and health. So, Kishan, just a last word from you.
I mean, on that point with the budget and Rishi Sunak, I think he's saying that NHS will get everything that it needs, and I hope it does in terms of resources. That's really important. Your viewers will know that I've been on for many years talking about it's been run down and there's been problems. One potential thing that should be looked at is we're getting people having to retire early as a result of the pension tax and the taper. So these are consultants that are not at risk. Rather than calling old consultants back that are 60, 70, 80 and long retired, these are people in their 50s that might be retiring. So I'd implore the Chancellor, if he's watching, to have a look at that and think about it and give as much support as possible to the people in the NHS on the front line.
Yeah, well, I'm sure he is watching, so he's heard what you had to say. Kishan, thanks very much, and Simon, thank you to you too. Thank you. Well, one of the economic side of